Well, some strong words today from rural hospital leaders upset over the Nurses at the Bedside Act that's making its way through the legislature. They say it could be the beginning of the end for them. Devon Rahming is here now to explain. Devon?
Well, Randy, those opposing this bill say this is the beginning of the end for nonprofit hospitals in Minnesota and are asking for Minnesota mediation as lawmakers decide the bill's fate.
This is a high risk, no reward decision that impacts people's lives.
Leaders from some of Minnesota's rural hospital systems making their voices heard Tuesday as state lawmakers consider the Keep the Nurses at the Bedside Act.
It's going to make our ability to care for patients much more difficult, and I really am worried that patients are going to suffer because of this.
The bill, which Mayo Clinic has also rallied against, would require hospitals to form committees that mandate staffing levels by defining a number of patients each nurse can care for.
In this proposed legislation, there are elements of it that fundamentally change the management of healthcare in Minnesota and would remove critical decision making from our care teams and our healthcare professionals and providers.
The Minnesota Nurses Association, which continues to support the Bedside Act, said in a statement, the only potential consequences for hospital administrators under this bill are a public grading system to give the public transparency about how well hospital systems do to meet the staffing goals set beside workers and management together. But the hospital execs that spoke today think otherwise and also say it wouldn't be fair to only exempt Mayo Clinic.
If there's going to be an exemption, it needs to be for all. We all are individual hospitals, but we also work together.
Now, lawmakers are still working to find a compromise on the bill. Meanwhile, the Mayo Clinic is threatening to pull $4 billion in investments out of Minnesota with plans to invest it in their other campuses if the bill is passed. Julie?
All right. Thank you, Devon.